Good afternoon. I'd like to welcome everybody to this pep talk. Please mute yourself, but always show your video picture, sign in your name, your Facebook account, or email address in the chat box. Please include names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk, so please show your beautiful faces in the video. Another reminder, after the pep talk, please take the online learning cum evaluation test exercise for mastery of learning and have the perfect score to get a certificate like the one shown here. The link has been placed in the chat box. Another reminder, 50 OLETE certificates were entitled 1 to a free voucher for an ROJoson telemedical consultation like this one. And I'd like to make a request. Please type in your feedback in the chat box during the open forum and before we adjourn. Thank you. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please show your face on the video. Ready? All your faces in. 1, 2, 3. On the top of 1, 2, 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk in May 15, 2021. There are 3 courses in the pep talk. I already completed the core course on October 9, 2021. And from October 23, 2021 onwards, I've been tackling health disorder courses and health issue courses like those shown here. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. My pep talk today is entitled, When to Say You Have a Breast Mass. The empowerment objective is to have an understanding of when to say you have a breast mass in their health management. So the content of this particular pep talk will be the following: when to say you have a breast mass, what to do after you have discovered you have a breast mass, and what to expect from a breast specialist after you have consulted him or her for a breast mass. So I'd like to have a disclaimer. The contents of my talk will be my thoughts, perceptions, opinions, and recommendations culled from the experience of other professionals and as well as myself. The emphasis of this pep talk will be the following: how to recognize the presence of a real breast mass during breast self-examination. So I'd like to emphasize the importance of a breast self-examination. And then what to do thereafter, relying on the expertise of a breast specialist who will give advice accordingly and with informed consent. Whatever he's going to suggest, there must be informed consent, emphasizing the importance of a breast specialist in this particular phase of the management, and not to jump to diagnostic tests without prior breast self-examination and breast specialist advice. So when to say that you have a breast mass, first of all human beings have breasts, okay, even males have breasts. So the breast tissues of males are usually dormant or inactive and remain small or flat throughout their lifetime, while the breast tissues of females are usually active and increase in size over time, particularly during puberty and adolescence. And once they reach their full size, they stop growing in size after adolescence, and usually it's about 18 years old, plus or minus 2 years. So thus, both males and females can have a breast mass developing in their breast, though it's usually very rare or uncommon in males. But you can also have breast masses in boys, in males. Both male and female breasts can have two general categories of unusual development or unusual findings. One is hormonal changes causing hypertrophy. Hypertrophy means layman's term enlargement, or atrophy, decrease in size. And then the other general category of unusual development is the development of a tumor or a mass, which can either be cancer or not cancer, or benign or malignant. So this shows the hypertrophy, enlargement, and atrophy, decrease in size. Okay. So progressive enlargement, this is part of normal development from before puberty, let's say during puberty, and then growing up, then up to adulthood, okay, or even with lactation, with pregnancy, and then atrophy at the time of senescence, like because of aging, okay, that's an 80 years old, 90 years old, okay. So this is normal. All of these illustrations are normal as long as there are no associated or underlying mass in the breast. So different sizes, these are normal expected development of the breast as long as there are no palpable or underlying mass on the breast. So if there is an underlying mass in or on the breast, then it is considered abnormal. So because it can either be cancer or not cancer. A breast mass is something unusual to the point of being abnormal. So this is how I will define what is a breast mass. It is something unusual to the point of being abnormal. So one has to differentiate the so-called lumpy breast tissue, which females commonly feel, especially during mens. So we have to differentiate lumpy breast from a dominant mass when we talk of palpation, looking for a breast mass. So this one shows an illustration of the lumpy breast. Okay, this is the skin, the fatty tissue layer, and then this is the main breast proper. So you can see that the surface are usually not on a smooth plane, but with irregularity or lumpy. Okay, so this is normal because it's part of the hormonal changes, which we call fibrocystic changes. So when you say fibrocystic changes, when you look at the tissue under the microscope, you have two types of changes. You have the cystic changes, which connote that there are fluid accumulation, collection there, usually very small, less than 1 centimeter, and then fibrous. These are so-called, these are not cystic component, but mga fibers that you will see on the microscope. So we have to differentiate this one from the so-called dominant mass. Okay. So a dominant mass is what we call the real mass. Okay. So it's something that stands out, different from the surrounding breast tissue. So if you have a dominant mass, then we say that you have a red flag, which needs further investigation. Okay. So this shows how to palpate the breast. You have to use the flats of the fingers so that you can differentiate the two. If you use the tips of the fingers, you might mistake the lumpiness of these breast tissues for a dominant mass. So we have to palpate the breast first using the flats of the fingers. And then later on, if we want to study the whatever we feel in detail, we can use the tips of the fingers. So in palpation, one has to differentiate lumpy breast tissue from a real mass, which is medically called dominant mass. So this is more or less round or oval hump with a feel that is different from the surrounding normal breast tissue. If there is a palpated dominant mass, automatically it is considered as a red flag. meaning it needs further investigation as it signifies an abnormality, a real abnormality. So to look for a dominant mass or to distinguish it from a lumpy breast, use the flats of the fingers to palpate and not the tips, at least initially. Use the flats. The flat just below first, we have 3 lines on the fingers. Okay, so the farthest area on the 3rd line is the flat of the fingers. So we don't use the tips first. If a dominant mass is felt, if you feel a dominant mass already with the flats of the fingers, now one can use the tips of the fingers to determine, because you have to determine what is the characteristics of the mass. Is it what is the size? What is the nature, whether it's cystic or solid? When I say cystic, it might contain fluid. Consistency, whether it's hard, whether it's not hard. And then the border, whether it's well-defined or ill-defined, and then whether it's fixed or not, etc. So these are the characteristics that have to be determined to be able to diagnose or to evaluate whether that lump is a cancer or not cancer. Okay. A dominant mass can usually be palpable if it is 1 centimeter or more. Okay. When you say palpable, this is with the use of the fingers, the hands of somebody. Okay. So less than 1 centimeter, the dominant mass is usually not palpable. So this is the limitation of the physical examination called palpation. We can only detect a dominant mass which is 1 centimeter or bigger. Okay, but for exceptional cases, in very, very thin patients, sometimes an expert breast specialist will be able to palpate a lump which is less than 1 centimeter, probably 0.5 centimeter. Okay, but this will be in the extremely thin patients. So when do you say that you have a breast mass on breast palpation? So the answer here is when you found on palpation, there is a dominant breast mass, which you think is not a lumpy breast surface. So this is the direct answer to this question. So this goes to show that a breast self-examination will be able to tell whether you have a breast mass or not. So my advice is usually, so do your monthly breast self-examination. So that's the first step in trying to say if you really have a breast mass. Another situation in which you can say that you have a breast mass is when a physician palpates your breast and found a dominant mass on your breast, the so-called clinical breast examination or the breast specialist breast examination. Again, the basis for saying that there is a real mass by the physician or the breast specialist is that it should be a dominant mass again, a dominant mass, and not a lumpy breast surface. So the same criteria that the physician will use to get as with a lay person. Okay, so looking to differentiate a lumpy breast from a dominant mass. Another situation in which you can say that you have a breast mass is when diagnostic tests, such as imaging procedures like ultrasound and mammography, if these are done, then it might be able to show that there is or at least suspected or even evident real breast masses. So showing how an ultrasound is being done and how a mammography is being done. So ultrasound will usually, first information that you will get is that whether there is really a mass, dominant mass. Also, they don't usually use the term dominant mass. They just go direct to the expression of there's a nodule, there's a mass, okay, and then they try to differentiate whether it's solid or cystic, okay, through the sound waves. And then for mammography, so it usually takes an X-ray of the breast, okay, show that so this is a normal mammography, and then there is a lump here, so which turned out to be a benign cyst, and then this is a cancer. Okay, turned out to be cancer because of the ill-defined border, and then this one shows calcification, which may be a signal for breast cancer, especially those with cluttered fine calcification, a cluster of fine calcifications. This could be used as to suspect breast cancer. So here, to illustrate, this mass was seen on mammography. You can see that the border is well defined, malinaw, okay, compared to this one, rugged edges, ill-defined border. Then you already suspect breast cancer. And then another clue, in 30% of breast cancers, usually they have these micro calcifications, maliliit na puti na tundik na calcium, no? But dapat kumpol-kumpol, that's why we call it a cluster. Kung hiwalay-hiwalay, kung meron dito, we don't suspect cancer. So to summarize, to the question when to say you have a breast mass, number one, you did a breast self-exam, and unfortunately, you palpated a dominant mass or more than one masses. The other situation is that you consulted the physician, and again, unfortunately, she palpated a dominant mass or masses. The third situation, you subject yourself to a imaging diagnostic tests like ultrasound and mammography, and unfortunately, the radiologist reported presence of the mass or masses. So these are the three situations. So the question is, what's next? After you have discovered a dominant breast mass in your monthly breast self-examination. Here I'd like to remind everybody, I put importance on breast self-examination. So this is the first thing that everybody should do a monthly breast self-examination to see whether you have a breast mass or not. So after you have discovered a dominant breast mass, then go see a breast specialist right away. But a question commonly asked ngayon by lay people, sino ba ang breast specialist? Okay. I'll just say it in a formal statement. Okay. A breast specialist in the Philippines at the present time is a general surgeon who has extensive training in breast palpation, operation, and other forms of treatment. Okay. So the advice is do not have imaging procedures done without seeing a breast specialist who will palpate your breast to verify your findings of a dominant mass. So this is on the assumption that you discovered that you have a possible dominant mass or a real dominant mass, and then let the breast specialist verify it. Kumisan mali ang kapa mo, mukhang mali rin ang perception mo that it's a mass. Okay. So with the breast specialist palpating your breast, okay, first before jumping to the ultrasound or mammography, so it may turn out that this examination may not be necessary after the breast specialist exam. So what if the breast specialist did not confirm your findings of a dominant breast mass? He or she says there is no dominant mass, pero sinabi mo meron. Okay, so what will he or she usually do? So she will make a diagnosis statement based primarily on his and her physical examination findings, and if needed, using the symptom data. So unahin niya yung put priority on the physical examination findings, especially the palpation findings, and kung kailangan pa ng data from what you feel, the symptoms, when it occurred, okay, kung may pain, etc. Okay. Then after that, she will make recommendations on what to do next. So here is a scenario, one scenario that I created now that is usually seen in the clinics. Okay. So after seeing a breast specialist, okay, the specialist made a diagnosis, no dominant mass, right and left breast. So the diagnosis, her diagnosis is the fibrocystic changes, normal breast findings. So what he's gonna do or she gonna do is to explain the findings and the diagnosis, then try to allay your fear and anxiety. Kasi lahat kayo, pag may nakapa kayong something, takot na tayo, baka cancer. Okay? So it's a specialist job to allay the fear, especially if it's not cancer. And then answer questions from you, and then give secured and informed consent for decided treatment obtained. He may recommend something, but you have to agree on it. Okay. So recommendations that can be done by the physician is one, in this particular situation, observe and do further self-monitoring. Do monthly breast self-examination. That will be the advice given to you. The return for follow-up checkup. Okay. There will be some advice on that, when to come back for checkup. And then you can say also, there is no need for diagnostic test because ang findings lang niya is that there is no dominant mass, it's just a fibrocystic changes. So I like to emphasize that here is a example of a situation in which you don't need the diagnostic test like ultrasound and mammography. So ibig sabihin, not all persons that have complaints of possible breast mass will undergo diagnostic test. So it depends on the breast specialist's physical findings and diagnosis. Another scenario, so this time, okay, ang mass sinasabi ng specialist, there's no dominant mass, right and left breast, fibrocystic lang, normal breast. Ang mass ang nakakapa ng pasyente, sinasabi niya, prominent rib lang. Okay? Yan ang sinasabi ko. Baka mali ang palpation nyo, perception nyo. So, a person might be palpating a prominent rib, yung tadyang, no? And then, which she regarded as a breast mass. So, pagdating dun sa breast specialist, nasabi ng breast specialist, ay ano lang yan, prominent rib lang yan. Okay? So ganon, she will do the explanation and then allay your fear and then answer your questions, get an informed consent for any treatment that might be done. And basically they will say there's no need for diagnostic test. Just do your monthly breast self-examination and then have a checkup afterwards, follow up. Okay? So scenario number 2, there is really a breast mass. So what if the breast specialist confirm your findings of a dominant breast mass? What will she do? Okay. So example, he will say, okay, nakapa niya. So ang diagnosis niya is there is a breast mass talaga. Okay, tama, on the right side. And the diagnosis is fibroadenoma. When you say fibroadenoma, it's a benign condition. Okay. So the breast specialist will give explanation of the findings and diagnosis, options for further management and treatment, okay, here below. And then, allayance of fear and anxiety. Sasabihin sa'yo, ay, mga 90%, 99%, ano lang yan, fibroadenoma, para to allay your fear right away. So, hindi niya sasabihin, usually, dapat hindi sabihin ng pasyente ng doctor, 50-50. Dapat meron siyang, it's either more of cancer or more of benign. Then, kung may mga tanong kayo, you should try to answer that informed consent for the treatment that might be, subsequent treatment might be done. So, ito mga options that might be given to you in this particular case, fibroadenoma, pwedeng kumalit lang, pwedeng observe and monitor, do your monthly breast self-examination. Okay, so ibig sabihin, hindi lahat ng fibroadenoma na kailangan tanggalin. No? Okay. Or another option is to do a needle biopsy if you want to increase the degree of certainty, let's say from 90% to 99%. Okay. Excision biopsy, kung medyo malaki na, okay, tanggalin na. So, or before these procedures, he might recommend that you do an ultrasound first prior to the biopsy and excision. So there are other options for further management and treatment, which will be explained to you, recommended to you, and then before any decision is made, there must be an informed consent or even an informed refusal. Kung ayaw mo yung needle biopsy, you can tell the doctors, no? And then that's a type of informed refusal. No? But if you agree to a needle biopsy, that's an example of an informed consent. So, another scenario, na-confirm na may bukol ka, pero ang diagnosis ng breast specialist may breast cancer. Okay. So again, the breast specialist will explain the findings and diagnosis, options for further management and treatment like those shown here, and then alliance of fear and anxiety, especially those as indicated. So, of course, when you have cancer, mahirap i-allay ang fear, but we can say that yung cancer mo, early stage, pwede pa, no? Habulin natin, maganda ang chance. No? So that's an example of alliance of fear and anxiety. Then queries answered, informed consent for decided treatment obtained. So these are the possible options that can be offered by the breast specialist: biopsy, either needle aspiration, core needle, and others; ultrasound prior to biopsy and excision; surgery, chemotherapy, radiotherapy, etc., etc. Okay. So all of these options will be discussed by the breast specialist using the BRCA. P stands for benefit, R stands for risk, C stands for the cost for each procedure, and then the availability of the procedures. So, what if the diagnostic tests are done? Another situation here, in the presence of a breast dominant mass. So what will the breast specialist usually do next? Again, he will make a diagnosis statement based on all the accumulated data on hand, because you have PE data, you also have palpation, self-palpation findings, and also you have findings on the diagnostic test. So these are all the data that the breast specialist will use and then put them together, come out with a diagnosis. Then she will make a recommendation on what to do next. Okay. So suppose meron ng ultrasound, no? It shows talaga benign fibroadenoma. Again, he will do the same thing, explain the findings, options for further management, alliance of fears, questions answered, informed consent, and then give you these options. Okay. Then suppose based on the kasama na yung ultrasound or even mammography kung meron, no? Ang diagnosis of that the breast specialist is breast cancer, yun din ang procedure. So the breast specialist will explain the findings, okay, options for further management, alliance of fears, answer all the questions that you may have, and then get an informed consent from you for the decided treatment after explaining all of these options. Okay. So, what if the diagnostic tests are done in the absence of a breast lump? What will the breast specialist do next? Kanina, yung scenario is in the presence of the breast lump. Ngayon, ginawa kasi sinama ko lang dito kasi maraming sitwasyon na may mga test na ginagawa in the absence of the breast mass. Kasi sa ngayon, left and right yung mga laboratory test. Diba? Okay. So, suppose the doctor, the breast specialist, gather all the data. Okay. Wala siyang nakakapangbukol. Okay. Okay. And then, ang diagnosis lumabas dun sa ultrasound or mammography, fibrocystic changes lang. So, maswerte. Okay? Wala. Okay? So, same thing here. You observe lang. Okay? So, advise on further diagnostic tests as indicated. So, walang operasyon, walang gagawin. Now, suppose based on the ultrasound or mammography, may tinatawag na suspicious for breast cancer. Pwede mangyari yon. So, because of the ultrasound report, nakalagay breast cancer suspicious, mga BI-RADS 4, BI-RADS 5. Okay. So, the same processes that the physician will have to do, explain the findings, options for further management, alliance of fears, queries answered, informed consent. Okay. So, the options that might be given is that he might suggest mammography, a biopsy through a mammography or ultrasound guided, or repeat tests in another centers, or do an additional test. Okay. like CT scan or MRI, etc., and others. Okay, so it all depends on the recommendations of the breast specialist. So, summary and takeaway for this particular topic is the main question is when to say that you have a breast mass. Okay. So basically, we answer it this way. So you did the breast self-examination, and unfortunately, you were able to palpate a dominant mass or masses. So that's the first scenario, first situation in which you can say that you have a breast mass. Then after that, when you consult the physicians, and unfortunately, she was able or she was able to palpate a breast mass, and then talagang may breast mass. Then the third one, you subjected yourself to imaging procedures and sinabi ng radiologist, merong bukol. Okay. So among these three scenarios, they all have to be validated eventually by the physician or the breast specialist. Okay. So another take-home message is that to ensure validity of your findings of a breast mass on breast self-examination, make sure to differentiate lumpy breast surface from dominant mass. Once you palpated a dominant breast mass, go and see a breast specialist right away. Do not have imaging procedures done without seeing a breast specialist who will palpate your breast to verify your findings. Because they may not be necessary after the specialist examine you. So on the first consult, the breast specialist will examine you thoroughly and as accurately as possible. He or she make a diagnosis statement initially based on primarily on his physical findings, and if needed, the symptom data. And then he will make recommendations on what to do next, particularly whether you need diagnostic tests or not, and which ones. And then supposing that you have a subsequent consults, follow-up consults, especially if the diagnostic tests were done, the breast specialist will make a diagnosis statement, again, based on the accumulated data on hand. Then she will make recommendations on what to do next, particularly on the treatment, what to do. Okay. So I have discussed all of these topics. I won't repeat it anymore. So as I said, the emphasis of this talk is how to recognize the presence of real breast mass during breast self-examination, and then what to do thereafter. Okay. I'd like to emphasize the importance of a breast specialist and not to jump to diagnostic tests without prior BSE and breast specialist advice. So take away in relation to patient empowerment, be always in touch with reliable medical information and how to recognize presence of a breast mass and what to do thereafter. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, kapangyarihan, to gain greater control over decisions and make better decisions in recognizing real breast mass and what to do thereafter. So this ends my pep talk. I hope I have empowered you to have an essential understanding of when to say that you have a breast mass in your health management. So before we go to the question and answer portion, let's reminder, please take the online learning kung evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this one. And then 50 OLETE certificates will entitle one to a voucher for a ROJoson telemedical consultation. And your feedback, please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we go for the interactions. Ready? Get set. 1, 2, Okay. So the floor is now open for questions, comments, sharing of experiences, okay, and consultations. Pwede rin. Okay. How many are doing breast self-examination? Can I have a raised show of hands? 1, 2, 3. 1, 2, 3, 4, 5, 6, 7. Okay, that's nice to see. Okay. Marami, majority. Okay, at least. Okay, please continue to do so. Okay. So, as a reminder, okay, when you do your breast self-examination, you use the flats. Use first the flats of the fingers. Okay. Yung dito. Nakikita niyo? Okay. Not the tips. Wag yung dulo, no? But the flat. No? Okay. And then, when you palpate your breast, itaas lang yung kamay on the side of the breast that you want to palpate, and then press against the chest wall, yung sa breast mo. Kaya paikot-ikot lang. No? Okay. So try to feel if there is a dominant mass. Okay. Kung meron kang suspecha na may dominant mass, then you can use, this time you can use the tips of the fingers to check. So we all know that the tips of the fingers are more sensitive than the flats of the fingers. Okay. Kaya if you use the tips of the fingers, kahit yung mga maliliit na butil-butil na lumpy breast, you can mistake that for a lump. No? And we don't like that to happen. No? Kasi baka false alarm, baka matakot pa kayo. No? Okay. So use the flats of the fingers first. If you are able to palpate a lump there, that if you have a dominant mass, then after that, you use the tips of the fingers to recheck kung talagang meron. No? Okay. And then try to determine yung mga characteristics. No? Okay. In terms of size, in terms of yung mga kung gaano katigas, gaano kalambot, no? Kung may tubig, minsan may fluid siya, no? Okay, you can palpate it kung may fluid, no? Or kung hindi siya gumagalaw, no? Okay. So look for signs of cancer. Kung meron cancer, okay, malas mo lang, baka cancer, no? Kung wala, mas maganda, masaya kayo, no? Okay. So after palpating your breast, you can, okay, pwedeng i-press mo na rin yung nipple mo to see for any discharge, no? Then after that, palpate your kilikili. So when you palpate your kilikili, nakababa yung kamay palagi, no? The reason nakababa ang kamay is that para ito yung fold dito sa kilikili medyo malambot para may papasok mo yung kamay mo up to the tip, no? Kasi kung nakataas, medyo firm, 'di ba? Rigid itong skin mo, mahirap makapayong sa ilalim ng hanggang tuktok ng kilikili mo. Kaya ibababa, no? Okay. Para malambot, no? And then isasalat mo lang kung may kulani, no? Okay. So this is very important. If you palpated a dominant breast mass, tapos may kulani, malamang cancer na rin yan, no? Kasi we know that cancer spread. Usually they spread to the lymph nodes palagi, no? Okay, most of the time. No? Okay. Then you do the same on the other side. No? Okay. Ganun lang, kapala, then pisil, and then kilikili. No? That's the minimum. No? Okay. So if you're able to palpate one, kung wala naman, you observe lang. No? So masaya na kayo, wala, at least wala, and then observe lang. Kung may duda kayo, baka lumpy, you can still observe it, do your examination the next day, 1 week after, 2 weeks after, no? It's up to you based on your level of anxiety kung kailan kayo pupunta sa breast specialist. No? It can be 1 week, 2 weeks after you palpated something unusual. Pero kung talagang dominant mass na kapanyo, huwag na niyong hintayin, na kung sigurado na kayo. Na? Okay. Kung lumpy breast lang yung sinususpetsya ninyo, no? Pwedeng tama kayo, pwedeng mali. You just continue to palpate it in a few days to recheck. No? Okay. Okay. So any questions? Anything on the chat box, Abet? Okay. We have a question. Can you hear me?
Yeah.
Okay.
There's a question from Mrs. Jocelyn P. If ultrasound result in 2 hospitals shows BI-RADS 3, does the patient have to do a mammography or just repeat the ultrasound after 6 months to 1 year?
Okay. So that's a very good question, which is usually happening in this country, in other world, I think in other worlds also, in other countries also. Okay. Kasi maraming ultrasound na ginagawa, no? Maraming mammography, and then marami ding iba-iba yung mga recommendations ng mga radiologists, mga physicians, no? Okay. So let me answer this based on my experience now, what to do. So if the ultrasound results in 2 hospitals shows BI-RADS 3, okay, when I say BI-RADS 3, probably benign, no? Okay.
Yes.
And then, so ipasok ko na rin yung kasi sabi ko sa importante yung breast specialist examination, okay? If the breast specialist, I'm not going to say like me, okay? Okay, talagang agree with the BI-RADS 3. Okay, baka when you say BI-RADS 3, when you say probably benign, baka yung specialist examination like me, sasabihin ko sa'yo, fibrocystic lang yan. Sasabihin ko, BI-RADS 2 yan. Diba? Okay? If you use their lingo, sasabihin ko sa kanya, sa iyo, BI-RADS 2 lang yan, hindi actually BI-RADS 3. Sa radiologists, BI-RADS 3 kasi they tend to, kadalasan they tend to overread. Diba? There's a tendency for the radiologists to overread. No? Okay? Remember that, ha? Yung part of the custom tradition ng mga doctors, no? They tend to overread. No? Okay. So, kung sa akin, breast specialist examine you, wala talagang bukol, no? BI-RADS 2 lang, no? Okay, walang bukol, essentially normal, fibrocystic, then you don't have to go for a mammography. Okay. So a lot of hospitals, a lot of clinics, a lot of radiologists, palagi nila kino-combine dalawa eh. Sabihin nila, may ultrasound ka, sabihin sa'yo, magpa-mammography. Okay, tama? Okay. So I really don't know the real reason. I don't like to suspect na baka yung iba for mas maraming revenue, no? Okay. Yung iba naman baka hindi siya sigurado and they have the mindset that mas maganda kung may mammography. Kaya may mindset sila, sabihin nila, mammography is the best screening examination for breast cancer. Yan ang paniwala nila, no? Okay, up to now. So if they follow that mindset, they will always tell you, magpa-mammography ka. No? Okay. So that's why I said it's very important to have a breast specialist examine you. And that breast specialist, as much as possible, dapat minimalist lang. No? Minimalist breast specialist. Huwag yung maximalist. No? Okay. So
Okay, there is another one.
did I answer your question?
One more, Doc. Does the patient have to repeat the ultrasound?
Again, it all depends on the breast specialist. Kung confident siya na wala naman, you don't have to repeat it. No?
Okay.
Kung may konting suspetsya, let's say 10%, kung 1% lang, wag na, di ba?
Yes.
Kung 10%,
Pero yung interval, Doc, 6 months ba or 1 year?
it all depends. It all depends. No? Kung gaano kalaki ang suspetsya, kung depende on your, of course, the level of your anxiety also, di ba? As a patient, kung gusto mong mas maaga, gusto mong 6 months, di ba? Yung iba naman, okay lang yan. I believe in my breast specialist. Okay, 1 year. 1 year. So,
Okay, thank you, Doc.
dekahon yung mga ano nila, dekahon usually yung mga recommendation ng ultrasonographer. They have a recommendation, di ba? Repeat ultrasound, kumisan 6 months, iba
Yes,
1 year,
that's right.
iba-iba, di ba? Okay.
Yes.
So, I would suggest you let the breast specialist decide on it.
Okay, thank you, Doc. Sorry, I have to leave. Bye-bye. Thank you.
No problem.
Bye-bye.
Okay, there is another question from Chris Nesesha. Hi, Doc. Do you recommend dosing cylindrionic acid for cancer patients like us po? Then, meron down there, it's do not panic.
Ano ibig sabihin, do not panic?
I really don't know. She put it there.
Do not panic. Okay. So
Chris,
then,
would you like to explain it?
okay.
Sorry po, no mic for now.
Okay, when you, okay. Dosing. Yung, okay, I like to assume that that's solendronic acid, no? Okay, yung spelling nga medyo mali, no? Okay, solendronic acid is a medicine that is, I mean, do not panic if you found something. Okay, may added comment si Chris. When you say do not panic, I mean do not panic if you found something in your breast, consult a doctor. Okay, so that's a good advice. Okay, so when you find something, a dominant mass, or something suspicious for dominant mass, no, control your anxiety muna. Mahirap sabihin na do not panic, usually nagpapanik yung natin. So control your anxiety, see a breast specialist right away para ma-resolve the anxiety mo. No? Okay. So going back to the first question, solendronic acid is usually for those with bone conditions. Okay. So this is usually done for patients with bone metastases, no, from breast cancer. No? One, to strengthen the bone, but to others, they use it to say that sometimes it can control the breast cancer there. No? Okay. So personally, I don't do routine administration of solendronic acid just for the sake of control of the cancer. No, I rely more on, let's say, chemotherapy. Okay? So not on the solendronic acid. No? Okay. So personally, I don't. No? Okay, but there are a lot of physicians who would give solendronic acid at the first sign of bone metastasis from the cancer. No? Okay. So I rely more on the chemotherapy, okay, which might resolve the bone metastasis. Okay.
He has a comment there. Okay po, nabanggit lang minsan may nakausap ako sa PGH. Siya po ang nagpapagamot. Sabi niya, nagdo-dose daw siya ng ganyan.
Okay. Okay. So may kanya-kanyang indications na. So yung solendronic acid, as I said, is usually used for bone metastasis. Kung wala ka ng bone metastasis, hindi mo kailangan yan. No? Okay. So any more questions? Jeng, para pwede ba magtanong-tanong lang tayo para ma-stimulate ang discussion? So,
Dok, okay naman po kasi yung check-up pa sa inyo nung
share
last
your experience.
Nung pinakang unang-una kong check-up sa inyo, Doc, nung ako'y
May bukol ka, di ba?
June 12, 2012 ako unang nagpa-check up sa inyo kasi alam ko talaga kasi nakapa ako na may bukol ako na pina-check up sa inyo, almost 4 centimeter, Doc.
Okay.
Kaya noong pina-check up ko sa inyo, talagang ang advice niyo na talaga sa akin, yung recommendation niyo is breast excision. Pero salamat naman po at yung pong bukol fibroadenoma lang naman po, hindi naman po siya cancerous, benign po siya.
Okay.
Then mula po
Before you continue, sandali. Before you continue, nakapa mo yung bukol.
Yes po.
Nagpa-ultrasound ka ba kagad?
Hindi na po. Nung pumunta po ako sa inyo, hindi na po. Hindi niyo na po ako pina-ultrasound.
And then, hindi na kita pina-ultrasound.
Opo, hindi na.
So, yan ang isang style, isang approach ng doktor. No? Kasi iba kasi, may nakapa-ultrasound na nila kagad, o kaya, they usually, pag pumunta sila sa mga non-breast specialist, kasi may pa-ultrasound ka na, magpamamo ka na. Di ba? So, without the doctor palpating. Okay, hindi kinakapa. So, yung sa akin, yung nangyari sa kay Jeng, she went to see me, kinapa ko, so sinabi ko, fibroadenoma. So, we didn't have to go for ultrasound mammography.
Yes po.
Because of the size, 4 centimeter, we
Malaki.
operated on that, at lumabas nga, fibroadenoma.
Yes po.
Okay? Sige. And after that, nag-recur. May nag-recur, di ba?
Ano po, lagi na lang na continue na po tayo ng every 3 months nagmo-monitoring po tayo. Napatigil lang po noong nag-pandemic.
Okay.
Basta pa every 3 months po, since then nung 2012, lagi lang po tayong nagmo-monitor sa breast ko. Then
Ayun kay Jeng, after ilang years, 1 year, 2 years after, may umulit sa ibang parte. Di ba?
ay,
Tama?
yes, Doc. O, sa kaliwa.
Tama? Kaliwa.
Apo, kaliwa.
So with the same diagnosis that I gave her, we just decide to observe. So binigyan ko siyang option, tanggalin or observe. So ilang years na natin in-observe?
Almost 11 years na po.
So it shows that you don't have to remove all the fibroadenoma. Okay? Benign naman, di ba? Okay.
Yes, Doc. Saka yung sa right side, yun din, may nakita, naging 2, Doc. Nagkaroon pa ulit siya ng 2 bukol.
Okay. So, kaya importante yung breast specialist, okay? Yung how he will advise you in a minimalist way. Okay? Kasi
Yes.
iba, they will impose on you, etong gusto ko, ganun para sa iyo. Okay. So, I gave you the options, and Jeng decided to have observation. Kita mo, 11 years niya, dinadali yun. Meron pa 11 years. Up to now, meron pa siya.
Yes po.
So, mukhang nagme-menopause na siya. At lumiliit na.
Yes po. Nung pong last na meeting natin nung July 11, thanks God po at sa inyo, yung pong sa left side, sabi niyo po wala na kayong nakakapa. Then dito po sa right side na dating merong 2, naging 1 na lang, then nag-lessen pa po siya ang size niya.
Okay. So, yan ang illustration of magandang illustration kay Jeng, what I lectured. You need to see a breast specialist who will really decide what to recommend to you. Okay.
Yes.
Hindi lang basta-basta gawa ng ultrasound mammography, or tanggal lahat.
Yes po.
Okay. Any questions? Any additional comments?
Doc, this is Susan.
Susan.
Yeah. So it's possible that the size of a cyst or whatever tumor can decrease through time.
If it's benign,
It will decrease
if
through
it's
time.
benign, it can be, if it's benign, maraming klaseng benign condition, di ba? So yung fibroadenoma can decrease in size once you reach menopause. Kaya lang matagal. Depende kung kailan na-discover, Kung let's say, kung 17 years old siya, may lumabas, mahirap maghintay pa up to menopause. Di ba? Ang haba, di ba? Okay. So, yung mga macrocysts, yung mga may fluid, usually pwede ring mawala yon, no? Because these are due to hormonal changes, di ba? Pero yung mga cancer, usually hindi siya nawawala.
Okay.
Okay. Okay. So, kung sinabi mo, miracle, 1% lang. Wow, mukhang mawala. Okay. Did I answer your questions?
Yeah. Okay, thank you.
So, any more? Wala na sa chat box. Okay.
There's nothing more.
If there are no more questions, do we call it a day? O may pahabol? Wala na? Okay. Kung wala nang questions,
Wala.
call it a day. Ang next topic next week will be varicose veins. We will discuss varicose veins. No? Okay. Okay?
Okay, so.
Sige. We'll see each
Thank
other
you
next.
po.
Bye-bye.
Thank you po.
Bye-bye.
Thank you po, Dr. ROJoson.